we go. So, good afternoon, Mr. Stewart. How are you?
Good, how are you?
Good, good. My name is Mr. Andrew Richardson. I'm an exercise referral specialist. So, I believe you've been referred to from Dr. Smith from Newlands Medical. Yes. Okay. So, before we go into all the nitty-gritty about your health and what your goals are, what was your main reason for going to seek some medical advice?
Well, I need get a bit active for my kids and stuff like that. I live a very sedentary lifestyle and office job. I don't get many steps in a day and stuff like that. So yeah, I just need to be a bit more active than my doctor suggested.
Okay, yeah. And was this based off you being recently diagnosed with anything?
Well, I've got diabetes type 2.
Type 2, okay.
Which is linked to my hypercholesterol.
Okay. And with that there, have you felt your health get worse over the last few years? Do you feel very fatigued, quite tired after work all day and everything? Yeah.
Yes.
Okay. So if I was to take a guess at sort of your current work routine, you would drive to work or take transport?
Yes,
Yeah.
drive, yes.
Okay. And then at work, you would have a lot of like teas, coffees.
Yes.
And then
sucker for teas.
And go to like the university cafe, buy the ready-made meals, quick, okay, and then imagine after work you're just very tired, fatigued. Would you get a lot of time to prepare meals at home and stuff?
Well, I can make time if needs be.
Yeah.
But like I said, I've got a family at home, so
yeah.
Time gets in the way.
Would you eat quite late into the evenings as well?
Yes, because my work.
Okay, fair enough. Okay, no, that's fine. Yeah. So the first thing you should be aware of is that all this is very easily fixed. So a lot of it comes down to just managing your own lifestyle routine with it, and it's just putting in actual time for things and just making a bit of effort for all the times of the day to prepare for the next days or weeks ahead.
Mm-hmm.
So you've got your forms from Mr. Smith. You filled out a couple of medical forms, yeah.
A few stuff on here I didn't quite understand.
Yeah, well, I'll go through them all with you anyway. So, okay. So if you pass them over to me, I'll explain them with you now. Thank you, sir. Okay, so the first things we'll like go through is you're on medication as well.
Yes.
Okay.
Yes.
So the medication you will take whilst training still, none of that will actually change. The only thing we'll make you aware of is with your new exercise intervention, which we'll go on to, there's some things we'll take into account when training, such as you just have to be aware of not pushing yourself too hard, too early on. So a lot of times the training program will be start very low and gradually build up. So we're going to look at low to moderate levels of exercise, but gradually increase the volume over time. So you think of like a lifestyle change as a slow way of building up. I'm not going to throw you in the deep end or anything, because with these medicines here, you may find that you would either get fatigued very quickly, you may feel faint and stuff, or you, as well trained, may feel very thirsty, whatnot as well. So most of you would just keep yourself hydrated the whole way through. In terms of like other values your doctor has provided, your resting heart rate is quite good. Again, we can improve that anyway. Your seated blood pressure is on the slightly high side of within the normal range for your age and gender and whatnot. So again, we'll look to bring that there down. And Mr. Smith, he did make me aware that you're quite keen to learn more.
Yes.
As well, okay, yeah. And I think that's really good, because at the same time, even though I'm going to be showing this to you and explain to you, I want you to go away and have the tools so you can learn, and that way you can get your family, your wife and your kids involved, so they can give you a hand with your own training and exercise routine. So there's that one there out of the way. Then your lifestyle questionnaire, again, most of it is quite fine anyway. Again, you've made me aware of your medical conditions, that type 2 diabetes, hypercholesteremia. Do you know much about them? Would you like me to explain a little bit?
Yes.
Yeah, no problem. So hypercholesteremia is just simply you've got quite a high level of cholesterol, and usually is an indicator of potentially developing coronary heart disease, whatnot, or CHD. So very much we want to address just with, again, quite similar to type 2 diabetes, just lifestyle intervention, whatnot, getting yourself more active, because it reduces the chance of you having a stroke. again, you don't have that actual like sort of signs like what I can see looking at you, but generally with hypercholesteremia, you've got yellow patches under the eyes. So again, it is quite hard to recognize, but it's usually associated with other sort of medical conditions. With type 2 diabetes, obviously you've got some awareness of it with the medication you're on. Again, that is more to do with lifestyle, because again, type 1 is hereditary, whatnot. So again, we're going to be working on that one there. Again, more just watching what you eat. So particularly around dietary interventions, it would be Mr. Stewart reducing my sugar intake. Again, you still have like fruits, plenty, all that's good. Reducing my like fat. It's more just instead of for example, instead of going for, let's say, a fried piece of meat, we'll try and grill it, make sure the meat is low in fat, and giving you different plethora of different examples of meals, so you can make them at home, bring them to work and whatnot, and not just go for that quick, easy meal, which has obviously got more additives, sugars, fats, and whatnot in there as well. So you don't have epilepsy, good, and don't have any joint or mechanical pain, no lump swelling, good, and you talk about your medication, you don't smoke, which is great, and you drink on average roughly the weekend, getting socially between 2 and 3 pints and stuff every. Okay, that's fine. And again, obviously you have said here that obviously your regular diet at the minute doesn't include enough fruit and veg. That's fine, we're going to improve it, and whole grain bread as well. Again, we can add that in. Past the 2, you tend to snack between meals, and that's just between meetings when you're going to and from. Okay, that's fine. Okay, also, and you say you don't cook with polyunsaturated oil, so would you just use the standard oil, cooking oil? Okay, yeah, that's fine. So basically with this here, it's a lower fat, healthier way of just cooking your food. That's all it is. Doesn't really change the price of it or anything. And again, obviously you said here in your youth you used to be a lot more active at school, university, used to row as well years ago and everything. Okay, and that's fine. Okay, it's not a problem. So I'm thinking the main sort of goals for yourself, sir, would be, first one would be obviously controlling your blood sugar level throughout the day, so there's no like peaks and troughs, because you could say like after work you would tend to crash as well. Would you also drink a lot of sugary drinks, energy drinks throughout the day? Monster? Okay, okay, that's fine. The second goal we then look at is obviously reducing your body fat percentage and your BMI as well. Okay, and then linked to that will be reducing your blood pressure level. To help tackle those 3, we would then look to increase your muscular fitness and your cardiovascular fitness as well. Just building that base level, and then we could progress it off depending on how your goals may change and whatnot. And then the final goal, number 5, which would be increasing your own education and knowledge. So throughout obviously the session here and any future gym sessions coming to the clinic, we'll show you how you do it. We'll give you the program with videos off it as well, so you can go back, refer to further links as well. So you're quite happy with that?
Yes.
Brilliant. Okay. So with that one there, obviously we've got your height, your weight, some basic levels of fitness and stuff. Okay. And the reason why we take BMI now is because it is perfect for a client as yourself who isn't currently active. However, once you get more active, and also you've lost an X amount of weight, whatnot, then we'll look at other measures such as skin folds perhaps and whatnot. However, BMI at this stage is appropriate. I will say now, BMI isn't the best measure, but isn't the worst. So it doesn't take into account obviously the weight of your organs, your muscles, your bones and whatnot. So it would always be skewed on the higher side and everything. So then once we do more training and you get more physically active, we'll use better measures with that anyway. So don't be worried about when it says obese, because obviously people tend to associate obesity with people who can't really move or walk and tall. So don't be worrying about that. Okay. Other measures we're going to use throughout the program is looking at your heart rate, your resting heart rate, whatnot, and again what zones you're going to be training on all the machines. Same thing for like all the strength exercises. working up like to like what your repetition maximums are and what weight you're using for how many reps and sets. So we can progress and improve then by doing more sets or more reps, or just slightly increasing the weight, or slowing down the tempo of the movement, or actually reducing your rest times. Because you don't need to add on more weight to see improvement. There's many other ways. Simply, for example, if we were doing, let's say, shoulder raise, I can do it at the front. I can change the grip different ways, whatnot. I can slow the actual tempo, or I can change the whole range of motion with it too. So there's many ways to actually to see improvement in an area. During obviously the warm up, when we take you in for your first session, we'll do a whole like movement assessment as well, just to see what your range of motion is, any limiting factors and stuff that may have to change your training program with it. But the way the training program will be set will be around you, so you won't be given an exercise which you can't do. And if there's, let's say, there's something you would struggle with, for example, doing a squat because you'd be sitting down all day, we can just change it so you squat to a chair, just reduce the height, or use a wall. And again, we'll obviously try and take into account if you've got pain on one side or the other. So it's all about accommodating your own needs and everything.
That's good.
Again, that's pretty much it in terms of the assessment. So we've talked about that, or your goals and everything. So what I'm going to be giving you here is just a brief program of your actual training program. Again, these are just sort of some of like the guidelines we'll be then hitting and everything. So as we're going on through it, we're just going to be ensuring it's about just getting you moving. That's the key thing, just because you're going from zero, not really moving, and we're going to gradually build that over time. So week 1 and 2 of your 6-week plan will be, you will look to do a walk 30 to 35 minutes, again just in the forest, somewhere it's green, very nice, we're relaxing. Then we'll have one workout with me. And then we'll do that for the same week, so that way you can reflect and learn, see what you like, what you didn't like, how we can improve it. Then on weeks 3 and 4, we're going to increase and add in an extra walk, but also more focusing on your dietary intervention. Then weeks 5 and 6, add in a second time in the gym, just working on the different parts of the body, whatnot. And in both those sessions, the gym will be both CV on the bike, starting off with, just again get easy, so it's the weight bearing isn't too much on your actual knees and whatnot, joints and stuff, and then showing some basic movement patterns. Then that's from week 1, 2. Then in week 5 and 6, we will replace one part of the cardio section back on the rower. Okay. Happy with all that so far?
Yes, I am. Thank you.
Good, nice. Now, obviously for us, the big thing for yourself is learning and being educated the whole way through. So obviously, I've made this little sheet here for you so you can understand your blood sugar level, okay? So this is just here. So I'll be going through this here quickly with yourself. So ideally we want you to have you in row 2. So again, so your blood glucose is between that 6 and 10, ideally. And obviously you can measure this with yourself, you have equipment, and Dr. Smith has provided that with you. At any time you feel your blood sugar level is too low, again you just have to have a quick snack standby, which again I'll explain that under the meal plan, how you can make one and everything. Again, just something sugary, that's all way, with some like carbs and everything in it to bring it up. And any time that is too high, we can't exercise because we don't want to risk pushing you over the edge and stuff, so it's always better to just like rest and also make sure your health's good. However, and you turn the page on the other side, so again this is more important for not only yourself but your wife, family and friends. If you were to go into hypo, so that's going down the graph on the left hand side of the page. If you were to go into the hypo and we bring your blood sugar level back into the normal range, we won't train that day, but it's about trying to work out why and how that happened. Okay? Quite happy with that there and everything?
Yes.
Yeah, so I imagine the wife will be very happy knowing that your health being looked after anyway.
Exactly, yeah. Some people would.
Good. And obviously the last couple of things from me would be, I imagine time is just the biggest barrier, just trying to fit everything in throughout the actual day. Okay, that's fine. So what I'm proposing is, at your work I imagine they have a gym.
Yes, there's a staff gym.
Staff gym there, and obviously, how flexible are you with your timetable? Do you get control of your actual diary to book meetings?
I do and I don't. Some meetings I put in.
Some days,
yeah.
okay. So it's just trying to work because each week may change and stuff. So I imagine during September to December, very very busy throughout the weeks. Then it'll quiet off, and then the summer it's very dead as well.
Yeah.
Okay, that's fine, no problem. Okay, and do you have any other questions for that anyway?
No, everything's been covered. Thank you.
Okay, no worries. So what we'll the next step from here, Mr. Stewart, will be, I will send you out the program and diet. Then we'll go on through it, and then we'll go into our first training session. Okay, but looking forward to working with you.
Me too. I'm loving it. Cheers. Thank you.
No worries.